So earlier this month, our government introduced Your Health, a plan for connected and convenient care. A plan that focuses on providing Ontarians with a better healthcare experience by connecting them to more convenient options closer to home. A plan that says goodbye to the status quo and welcomes innovation to help Ontario respond to growing health challenges and changing needs. Today, we are taking further action to advance our plan by introducing the Your Health Act. The proposed legislation outlines our next steps to reduce wait times for surgeries, procedures, and diagnostic imaging, while enabling our new as-of-right rules to automatically recognize the credentials of healthcare workers registered in other provinces and territories. Based on feedback from frontline partners, the Act will, if passed, put in place significant guardrails to integrate community surgical and diagnostic centers into the health system and enhance quality standards and oversight while protecting the stability of doctors, nurses, and other healthcare workers in public hospitals and other healthcare settings. Ontario Health will ensure these centers are embedded in regional health system planning, including reporting into one centralized waitlist, which makes for a seamless experience for the patient. And community surgical and diagnostic centers will coordinate with local public hospitals to accept patients that are being referred, ensuring people get the surgery they need as quickly as possible without jumping the line. We've also strengthened the application process to receive a license for these centers. For example, before receiving a license, centers would consult with healthcare partners, including public hospitals. And our legislation will mandate that physicians employed by community and surgical diagnostic centers must have privileges to do the same work in a hospital. We are also proposing changes that will mandate every center to have a process for receiving and responding to patient complaints. And if they are not able to have their complaints addressed at the center, the Your Health Act, if passed, will now bring community and surgical diagnostic centers under the oversight of Ontario's Patient Ombudsman. We expect the Ombudsman to report on any patient complaints and will adjust quality and oversight controls as needed to be responsive to these concerns. These changes will be consistent with the Canada Health Act. And again, we need to be clear. Ontarians will continue to pay with their OHIP card, never their credit card. Under Premier Ford, that will never change. We know that early detection and diagnostic of a health issue has an immense and immediate benefit to a person's quality of life, prognosis, and treatment plan. Our bold and innovative plan will significantly reduce surgical and diagnostic wait times, enhance collaboration across the health system, and ensure patient safety will continue to be paramount. In January, we announced that we are breaking down barriers to allow healthcare workers registered in other provinces and territories to immediately start working and caring for people right here in Ontario. These proposed changes will allow certain registered health professionals from other jurisdictions, including physicians, nurses, medical lab technologists, and respiratory therapists, to practice immediately upon arrival. These changes will help healthcare workers overcome bureaucratic delays that have made it difficult to practice in Ontario. With the Your Health Act, we are taking action to fix the status quo, a status quo that we all know is not working. And we are putting Ontarians back in charge of their health, making it easier to navigate care at every step of life. Whether it's an emergency in the middle of the night, a problem that's been bothering you for years, no matter where you live, we want to connect you to more convenient care closer to home. Thank you.
Minister, I've had emails from readers in regards to the cataract situation in particular. They've been to for-profit clinics and they've been told they can get treatment faster if they pay for a more involved cataract test than the one OHIP pays for, or if they want to get more fancy lenses that do more than the basic OHIP lens. So it seems you haven't been able to prevent these, this kind of upselling or extra charges now. So why should anyone believe anything in this plan when you talk about patients being protected?
So there's a couple of things that are embedded in the legislation that I think are important and cover off the examples that you raised. First is, today, currently, we have that they must post their fee schedule inside the location. We will now add on their website. We have now ensured through legislation, if passed, that the community surgical center cannot, and will not refuse patients who decide to choose the OHIP covered service as opposed to additional options that may or may not be available. Third and finally, of course, is if and when, while we have a complaint system in the Ministry of Health today right now, we are adding an additional oversight, and that ensures that individuals who believe that they have been improperly served or had an issue with a community surgical center will have the option to bring forward that complaint or concern to the patient ombudsman, something that is not available today.
How long does it take for the patient ombudsman to respond to complaints currently?
So it would really depend on the level of the complaint. Individuals first have to go to their local, in this case, hospital or community clinic, and then if they do not receive a satisfactory response, then they can take it to the patient ombudsman. It would be challenging to be able to say, and the process will take X number of days, because it depends on the complexity of the complaint that is being brought forward.
Are you going to put any more money towards making the process faster?
What we are ensuring is that the patient ombudsman must publicly share the information that they receive on the complaint and the results.
What about poaching, Minister?
Oh, I want to ask about the getting on this complaints issue. The legislation doesn't designate this body that will do the inspections. Why not put that in there? You haven't even decided who the regulator is going to be yet.
So there are a number of options that are on the table as to who would do the assessments, both initially when a clinic is being assessed to see whether a license should in fact be given, and of course upon renewals, or if there are issues, the regular process of ensuring that what the clinic has been licensed to provide is actually happening.
People are concerned about safety of these clinics, for example. If that's a concern, you've been addressing that yourself, talking about guardrails and enhanced safety. But there's no regulator yet. Well, why not have the regulator sorted out before you open up and have all these new clinics come?
So there are a couple of options on the table. We will, through regulation, ensure that the appropriate regulator, whether that is an outside regulator or in-house, is happening. But the legislation is very clear that there will be a process for both complaints and the regulatory piece, because all of these clinics have renewal processes as well. It is not a one and done, where once you receive a license, you will have it in perpetuity. There is a renewal process that is part of the application or ongoing maintenance, and that will be part of the additional responsibilities.
Potential regulators are?
I not at this time.
Minister,
how many
what about
licenses?
poaching? I mean, hospitals say they don't have enough staff and they worry about them leaving. How are you going to prevent these private clinics from taking staff from hospitals, especially if they're offering maybe better hours? Can they offer better pay? How are you going to stop an exodus from the hospitals?
So again, in the application process, it's very clear that the individuals who are applying for these licenses will have to lay out very clearly how they are going to ensure that they have appropriate HHR. They have to work with their community and local hospitals to make sure that the services that they are wanting to offer are actually needed. So there's lots of places along the application process where there is an assessment of HHR. And thirdly, physicians in particular, of course, have to have hospital privileges at a community hospital that is offering the same service.
What about nurses? What's to prevent nurses from leaving and going into these places instead?
As I said, that is in the application process, where they are going to have to lay out exactly what their HHR, their Health Human Resources plans are.
But can you stop it? can you stop them from, I'm sorry, I guess I'm not following you when you say it's in the HHR
Well,
plan. How
an
would you
application
stop it?
process doesn't mean an automatic approval. So the application process, by its very nature, if you cannot fulfill all of the set out parameters, guidelines that we have demanded as part of the assessment, then there is a high likelihood, I would suggest, that you would not get a license.
Minister, through this process, you've talked a lot about people not paying for healthcare with their credit card. We found out that there are doctors that are, at some clinics, they're offering rapid access to healthcare through nurse practitioners for a fee of about $30 a month. Wondering what you think of this. These doctors are saying this provides people faster access to primary care, and why is it that the province doesn't fund nurse practitioner services across the board?
So I'd want to look at the very specific examples that you're highlighting, but I can tell you that that multidisciplinary approach that happens when you bring primary care physicians, nurse practitioners, dietitians, mental health workers together is a very positive model that people are embracing, because those practitioners really appreciate the ability to not have to refer their patients elsewhere. They want to be able to say, we have the ability to help you here in our community health center or our family health team, and we'll do that. Specifically regarding the example that you gave, I would...
So these are doctors that are on fee-for-service, so they're not part of a family health team or a community health clinic, and they're saying, here's an extra, you can pay $30 a month and you get, instant access to a nurse practitioner, and it's not covered by OHIP.
So fee-for-service docs generally would not have nurse practitioner. So again, I'd rather get more specific so that I can answer in detail.
I mean, I sent your staff actually this question last week, so you should have been briefed.
We'll
on
follow
it.
up.
Minister, in terms of these licenses, how many is the province willing to hand out, and is there any kind of cap per jurisdiction?
So what we're really going to focus in on is where the wait times are. So whether that is in a particular community or with a particular procedure. You saw in January when we made those announcements in Ottawa, Kitchener-Waterloo, and Windsor for cataract surgeries. It was very specifically because those three communities had a longer than average wait time for the provincial average, and there was sufficient capacity in operators that were already existing in communities. So it will be a combination of where and what are the procedures that have the longest wait times for people, and if there are applications that are in those communities that need it the most. So it's not a hard cap in terms of how many we will be giving out. And this application process is not a once a year one and done. It is, here's the process for how you apply and what you have to do in terms of the thresholds you must be able to do. And I anticipate that while there will be some pretty serious interest, that it will take time for those operators to work with their local hospitals, to work with their local health teams, to make sure that they understand where the wait times are and how they can most appropriately serve that community in community. Because this is really all about making sure that people who have long wait times just because of where they live in the province of Ontario aren't unfairly treated because of those wait times.
Will you make public the terms of the agreements with all of these community surgical centers, like how many surgeries they're contracted to do, what the fees are? Will that be made public?
So there will be some material that will have to be kept private because of the business model nature, but the standards in which all of these clinics will practice will be consistent and will be made public.
Do you have a target for how many surgeries you want done in these clinics? I know you're saying there's no cap on the number of clinics, but do you know roughly what you want to get to that could maybe help out hospitals?
What I know is that people should not have to wait for months for diagnosis and, if necessary, surgeries. What we are changing is ensuring that as those wait times continue to grow, we are actually putting in parameters and opportunities for communities that have historically not had a community surgical clinic to be able to have one in their community.
So does that mean you will keep adding clinics until you get to like a zero sort of wait list?
No, that's not what I said. So what I said is it's inappropriate and unfair for people to have to wait as long as they are waiting right now. Look, our hospital system has done incredibly well. Our partners have very much stepped up with the assistance of the $300 million surgical backlog program to make sure that the capacity that they had available in their communities and in their hospital ORs was being used. And I'm proud to say that by the end of March of this year, we will be back to our pre-pandemic numbers. But let's be clear, pre-pandemic numbers still had wait lists. So we need to deal with the fact that people want access, and this is a way to get that access faster in their communities.
You talked about the sustainability of the staffing plan that these clinics would have to present. If the plan includes things like what we're seeing now, which is reduced hours at a hospital, let's say, they're saying we can staff up, but it will mean reduced hours, closed on weekends in order to make it work. Would that be acceptable to you?
So any suggestion that we take HHR, Health Human Resources, away from one sector to add to another? No, absolutely not. What we are doing is, as part of your application process, making sure that you have clearly mapped out and are able to articulate how you are going to staff and continue to staff the model. We know through our investments in for example, short, medium, and long-term goals, right? We had, when a minister's letter directive went to the RNAO, the College of Nurses of Ontario, we saw a record number of applications assessed and ultimately approved. Over 6,000 internationally educated nurses were licensed in the province of Ontario in 2022. That was a historic high. So we will do the short, medium, and long-term work. The longer term, of course, is 2 brand new medical schools. So we understand that we want to continue to train and offer opportunities for individuals who wish to practice in the province of Ontario, whether it's as a PSW, an RN, a nurse practitioner, or a doctor, and we'll do that work. But we also need to appreciate that there are patients who are waiting too long for services that can be done safely in community, and we want to give them that opportunity.
The government has said that the concerns about this plan are scaremongering. But what if they do turn out to be true, that this is going to cause hospital staffing problems and a decline in the quality of the public system? Is the government willing to backtrack if it turns out that the concerns about this plan were justified?
Look, there is always opportunities for best practices to be spread and encouraged and added to existing processes and policies. What I can tell you is that the Ontario Hospital Association appreciates and understands that the status quo is not working, and that's why, because of our ability to work with our partners, we've been able to bring forward legislation that I believe, if passed, will give us the added capacity and the guardrails that the people of Ontario deserve.
But what if you're wrong? What happens if it does exacerbate problems? Are you willing to countenance that possibility?
So, as I've said, we have and will continue to add health human resources, whether that's through a learn and stay program that is now not only available to nurses, but also to paramedics and lab technicians in the province of Ontario. Look, when our government sees good ideas and sees them working in community, we are more than happy to embrace those and embed them in policy changes.
Minister, you're ramping this up at a time when there is arguably a need for increased centers to perform these surgeries to cut down the backlog. What happens when the need is no longer there? What happens under the best case scenario when we get to that zero level in terms of the backlog? Do you start to then revoke licenses, or do these just continue to be in existence in perpetuity?
So I want to be clear that we have over 800 diagnostic and surgical centers in the province of Ontario right now. We don't have sufficient need. The capacity needs to be expanded. So the suggestion that within a year or two we would get down to a zero wait game, I think is frankly very unlikely. What we want to see is the access for people to do it. I mentioned at the beginning of my comments that these surgical centers right now and will continue to have renewal policies in there. It is not a license in perpetuity, so that will be part of the assessment. But make no mistake, we've had surgical backlogs and diagnostic delays in the province of Ontario for decades, and this proposal through your health plan and your health act is a solution to a problem that has been very long-standing for decades.
What's the
That's fair
target?
enough. That's fair enough, though. But looking, somewhat into the future, at what point do you foresee, or is there anything you're unwilling to let go from an Ontario hospital to one of these facilities? Are there things that are sacrosanct that have to be done in the hospital, or can these facilities at some point when there might not be a huge surgical backlog, could they be used in other ways? Is that part of your plan or your vision for the future?
So I want to be clear. This is not removing a procedure out of a hospital and giving it only to community clinical centers. This is an option that is ensuring that wait lists are dealt with. So I think that's really important for people to understand, that this is not a we're taking something away from hospitals and giving it to another organization. That really needs to be very strong. There is no doubt that there will always be highly technical procedures that will have to and continue to be done in our hospital, publicly funded hospital system. What we are doing with the Your Health Plan and the Your Health Act is ensuring that for those less challenging surgeries, that we have another pathway, another option for patients.
This will be the last question.
Minister, can you explain why private hospitals are excluded from, they're not allowed to apply for these licenses and open up these new clinics? Why is that?
Because they already have a license.
You also mentioned, though, as part of the safeguards, that these clinics will not be allowed to accept, say, if I want to pay to get my surgery ahead of time. We know that private hospitals that operate in the province right now on their website will sell me, I can go to a out-of-province clinic and jump the queue and pay tens of thousands. Will you crack down on that? Will you stop that practice? Will IHFs, or whatever we're calling them now, be allowed to do that?
So again, what we are dealing with and what we are improving in the province of Ontario is an expansion and an opportunity for clinical clinics, surgery clinics in community. If an individual makes a personal choice to go to a different jurisdiction, that is obviously outside the Ministry of Health's purview.
All right,
Thank you.
everyone for coming.